One of the most common things I have as a chief complaint from patients is that their heel hurts. A lot of times it's something called plantar fasciitis, and it's an inflammation of the plantar band. Imagine that you have all these layers in your foot, starting with the bones and then the tendons and the muscles and the ligaments, and then there's this thick band, this fascia that holds everything up. And that band is kind of like a rubber band, and as we mature, sometimes that rubber band becomes a little less rubber bandy. Often, if somebody is using the wrong shoes. We live in South Florida. Flip-flops are part of the Floridian wardrobe versus having a good supportive tennis shoe. What we do for it, and the most important things, are really starting out is doing our lifestyle modifications. And these are very simple things that people can do at home to not only treat it, but also prevent it from coming on. So the first one is stretching. And what we really, really want to do is before you get out of bed in the morning, imagine that rubber band. And if you have a foot like this, that rubber band originates in the heel, and that's usually where it hurts, and it'll insert in the metatarsal heads. If you take a towel or a belt, something that's rigid, and it's stretching that band, you have your legs straight, you don't even need to open your eyes. You just grab that band, put it behind the metatarsal heads or right behind the toe area, and stretch, 10, 15 seconds. This is not a whole physical therapy routine. This is you gotta get up and gotta get going, but you gotta warm it up. The second thing is the shoes. Most people in South Florida either have tile or hardwood, so we're walking around barefoot. Having a good pair of recovery type sandals or a supportive type sandal, something that will cushion your foot at home, is really, really ideal. So you're not putting that stress on that foot. And then at the end of the day, ice is Mother Nature's anti-inflammatory. So taking a frozen water bottle is always a good idea. Other things that can be incorporated, you can do some formal physical therapy. We can also do over-the-counter or custom orthotics, depending on the severity of the pain. When those options aren't quite cutting it and we have that inflammation and we just need to decrease it, in the office we can provide injections, a steroid injection. The injection will help decrease the inflammation. It usually takes 2-3 days to work. We do up to 3 of them in a year. And then quite honestly, if that really, the very small population that doesn't find relief with all of these things that we've modified in these injections, then we sometimes talk about surgery, which is releasing that plantar band. If you say, I have done my home exercises routinely, and you've modified your shoes and everything is still not coming together, you're still increasing pain, or you're just noticing that pain has not improved, then come see us. We will take an x-ray, we'll make sure we're not missing anything else. We further work on our treatment options. This could include formal physical therapy. A lot of times formal physical therapy kind of gets us going in the right direction, and then we can build on that with our home exercises. And it kind of really gives some guidance on what the proper exercises are and gives us a really good routine to continue on with at home.